Mozambique remained one of the world's poorest countries. After many years of colonial rule followed by civil war, the country is today faced with multiple challenges within the areas of agriculture, rural development, health and education. Despite extreme poverty, one of the greatest resources of Mozambique is its people and their will to become part of the development process for an improved life. In light of this situation, US Department of Agriculture and Planet Aid entered into an agreement in 2004 under the USDA-funded program Food for Progress. The partnership runs over 3 years and includes the donation of 990 metric tons of soybean products and 9,000 metric tons of soybean oil. The donated products are being shipped by sea from the United States to Mozambique, where the soybean oil is being sold to commercial buyers to pay for a comprehensive rural health and education program. World Vision in Mozambique were contracted to be responsible for the sales of the soybean oil.
Well, the sales went very well, I would say, Marie, because we had 100% recovery. Everyone has paid us. We've had no defaulters. And we had a really good cost recovery on the sales in Mozambique.
The proceeds deriving from the sales of the soybean oil are used over 3 years to pay for the establishment and operation of 4 holistic HIV and AIDS programs covering 400,000 people, 50 community soy restaurants serving meals for people in need of proper nutrition, distribution of soy to 2,900 families affected by HIV and AIDS, training of 450 primary school teachers, and organizing of 180 farmers' clubs with 9,000 members. The first element of the Food for Progress program focuses on the fight against HIV and AIDS. The project is called TCE, Total Control of the Epidemic. TCE is based on a systematic organization of a country, dividing it into geographical areas, each of 100,000 people. Each area is again subdivided into 50 fields, each with 2,000 people. In each field, the TCE program employs a TCE field officer. Each field officer is in charge of 2,000 people. The field officer visits every single household in his field and mobilizes all people in an all-out war against HIV and AIDS. The USDA-funded program is implemented by Planet Aid's sister organization, ADPP Mozambique, in the province of Sofala, and it involves the employment, training and monitoring of 200 field officers covering 400,000 people.
TCE brings a very holistic approach. And secondly, we have noticed that it also brings something that is unique in our programs, the way that people get involved, both as activists and also as beneficiaries. As you know, this is a program that takes place in the communities, and it involves foremost the families themselves. So it's a door-to-door interventions whereby people are empowered to take care of their lives, to protect themselves from contracting HIV and AIDS. But apart from that, if they are already infected, they are also empowered in terms of taking care of their sexual behavior, first of all, and also taking care of their nutritional behavior, I would say.
To provide good nutrition to a large number of people affected by HIV and AIDS is another element of the program.
They've established 50 soy restaurants. This uses soy products from the United States that are prepared locally by the people there. And it's very exciting. We're providing low-cost, good nutrition for people who need it. Many of the people with HIV/AIDS will get their food for free, and that's very important. There are people in the project called passionates. These are volunteers who maybe it's like the mother or the sister of someone who has AIDS. And these people can't help but be drawn to the project and want this to be successful. So these passionates are also being recruited and trained, and these are people, community workers, who are working, contributing for free to the project.
To start up the 50 soy restaurants, staff from the American Soybean Association's WISH program, together with TCE management, have trained volunteers and field officers to cook nutritious and tasty soy meals. The volunteers involved are known as TCE Passionates.
E o que fez a TC de organizar os restaurantes e aquele produto de textura de soja que veio por aqui e me decidi ser uma apaixonada daqui. Aqui em Moçambique está abundando muito sida. Aqui está abundando de muitas doenças que estão aqui. Agora, se a gente aumentar de soja, acho que as pessoas estão já reduzindo aquelas doenças que já vinham aqui muito mal. Agora está a ser um pouco melhor. Aqui está a valer. E as pessoas que eu passei a dar a soja, apanhei pessoas mal, mas agora já estão bem outros. Até já conseguem também fazer o que não faziam, por causa da soja.
Apart from serving nutritional meals, the people at the soy restaurants have access to written information materials in local language and an environment for people to know more about HIV and AIDS and the importance of nutrition.
Minha mãe, quando faleceu um dia, mas já está a fazer 2 anos. Embaixo. Meu pai também, mesma coisa, já está a fazer 2 anos. Assim, quando eu fiquei com meu avô, esse terceiro, quando chegaram lá em casa, me deram o nome, disse, você chega aí no restaurante. Meu avô também recebe. Depois, quando eles me deram o nome para aqui, eu disse, você sempre vem aqui no restaurante. Okay. E por isso eu assisto a vida. De manhã chegou na minha casa, disse, vamos no restaurante. Há muitas crianças mesmo que é órfã também como eu. Mas para eles, soja para mim também está bem. Nossos corpos gostam, tá bom.